Hey everyone, so this is part 2 of changing the caps on your Hickman line. So I discussed this in part 1. I've already got my supplies assembled here for everything. So we had already attached our caps to some saline syringes. And I actually didn't mention, but I want to mention that I like to get like either clean paper towels or a clean cloth towel to place over my area where I'm going to set up my supplies, just in case there's any dust or hair or any contaminants on the area. Dressing changes come with a sterile field, but we're not using a dressing change kit right now. We're just changing the caps, so we don't have a sterile field. So even though like a clean towel or paper towels aren't sterile, they still are a cleaner field than you might have. So an alternative is working on a hard surface that you can clean with like alcohol or something just to sterilize it. So it's really important to be as clean as possible. So I reassembled all of my supplies, and I'm gonna show you everything, and then I will show you how to continue changing your caps. So, alright, I've got everything set up here. These are my salines with the caps attached, the new caps. These are too extra because even though when you inject meds, flushing with 10 cc's of saline is adequate, if you're dealing with blood, either you're getting a blood draw, or if you're changing your caps and you're going to pull, when you put the new one on, you want to pull back till you get blood return. And so anytime you pull blood out of one of your lumens, you're going to want to flush with 20 cc's. So I go ahead and have an extra saline for each one. And I've got my heparin. I've got my Phenergan over there that I said I'd show you guys. So I'll show you how to draw that up. And a syringe for that. I've got a mask and gloves and plenty of alcohol swabs. So this is everything I have set up for this. Okay. Now, the very first thing to do once you get set up is go ahead and loosen your caps a little bit, because this can be harder to do once you have gloves on. So if you take each one, don't take it off, but just loosen it a little bit so that you know it will come off easily when it's time to take it off. So I have 2 lumens, I'm going to do both. Alright, so mine are loose and I can get them off easy now. Then I'm going to go ahead and put on a mask. These you can either buy at a medical supply store, or if you have dressing change kits, save one from there. The idea is that anytime you're working with an exposed access point, your breath has moisture and it carries bacteria. So even just looking at it while you're cleaning, you could unconsciously breathe bacteria on there, and you don't want to contaminate your line. I talked about that before. So it's just better to wear a mask, no matter if you're exposing your access, whether the insertion site or if you're changing your caps on your lumens. So that's why I wear the mask. So I'm going to go ahead and put my mask and gloves on, and then I'll show you guys how to do this cap change procedure. Okay, these that come in the dressing change kits, these guys are behind the ear masks, and they have a metal bar across the top that you're going to put against your nose. That's going to, you shape it to your nose to seal in on the bottom. My mom just got home, so the dogs are barking. Hey.
You got my message?
No, but I'll talk to you later. Okay, so we're going to go ahead and do that. And this pulls down so you can fit it, tighten, push it to fit the bridge of your nose, and pull underneath. That way you're not going to be breathing on your line. Okay, so I'm going to put my gloves on. And then I'll go ahead and do the cap change. Okay, so like you already loosened, so they'll be easier to clean now. Now I'll show you. I've learned this technique to clean them that works really well. Alcohol, when you're cleaning with alcohol, you need to be scrubbing the area for a minimum of 15 seconds for adequate sterilization. You're going to want to, so that's something to keep in mind. I would get a stopwatch because 15 seconds, it might not seem like, I mean, it seems like a long time when you're just trying to imagine it. So you can go by a stopwatch, or you can do the 1,000, 2, 1,000 thing, whatever works for you. If you don't have a stopwatch, most phones have it on them, most computers have it, so you can just look under your little program to find that. Alright, so these are loosened already. So I'm going to start, actually I'll start with this one just because it's easier to see the red one. Okay, so hold down at your hub right here, and you're going to twist your cap off. Okay. You have your alcohol swabs here. Two things that I do. The very first cleaning that I do, I just put an alcohol swab right on top and just wipe a little bit on the sides and take it off. That way, if you've had any salt crystal out of your saline, like if it leaked around the little lure lock on there, that gets cleaned off first. Then you can do the vigorous scrubbing on here, and I do that twice just to be safe. Make sure before you take your cap off that your clamp is closed, because you don't want either to pull air into your line or to bleed out of it. So leave your clamp closed until you're ready to flush. Alright, now the way that I've learned best to clean this, you're going to put your lumen in the middle of an alcohol swab on the diagonal, like this. Then you're going to fold the first half over, and you're going to fold the second half over that. Okay, so like this, right? Take that in your other hand. You're going to twist the top, and this actually make sure that you have every surface of the end of this line covered in the alcohol swab. And then squeeze very hard, take your hub and twist back and forth. 15 seconds, alright? So you can squeeze really hard, make it squeak if you can. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, this one's done. Lift it straight off. Get rid of it. I'm going to do the same thing one more time. Okay. So you're going to put your lumen in the front, in the middle of an alcohol swab, right? Fold one corner over. Take the other corner, pull it taut, fold that corner forward. You're going to take the top and twist it. Hold with your thumb after you twist it, and then pinch between your thumb and first two fingers like this, the top of your hub. And grab here, and then twist again, back and forth to the count of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. And then you're going to go ahead and take one of the salines that has a cap on it. Okay, so this is what we did in part 1. Got this all set up, right? Go ahead, now that you're holding it upright, check and see if there's any air bubbles on the bottom. If there is, do the flick technique again to get them up. Aspirate so you see the fluid. Take the cap, the protective off of this part off of your cap, and you're going to slowly push the fluid up through there till you get a bead of fluid on the top. If it overflows a little bit, that's okay. Don't worry about it. And you're going to go ahead, put this on your line, turn, just so it's a little bit on there. Then you can grab the cap and the hub and tighten. So this guy's done now, right? Alright. Now you open your clamp, and there might be some air that got trapped in between the hub and the cap when we screwed it on. So you're going to pull back a little bit. The other thing, you could check for blood flow, which is good, because you want to make sure this line is still open and flowing. So I'm going to pull back on the syringe while flicking down at the hub. I don't know if you can see the air coming out. I don't think so, but you'll get some air bubbles. I don't think that's showing up. Is it showing up? Anyway, you go ahead and do that. Pull back till you get blood. So you know you've pulled out all the air out of your line. And then when you are flushing your line, it's very important. You need to pulse flush. This will help agitate any blood cells that are aggregated on the inside of your line. It will help push them out more than just a steady pressure injection. So you're going to pulse flush. You're going to do small squeezes repeatedly, like this. Push, relax. Push, relax. Push, relax. Push, relax. Push, relax. Okay, so you're going to go ahead and pulse flush. Make sure you don't inject the air now that you took out of there. I'm leaving a little room because I can see my air up here. So take this out. Put it aside. I'm going to get another flush syringe like we talked about. I'm going to break the seal. Make sure there's no bubbles on the bottom. Pull down. Push up till you get the bead on top. You're going to twist this into your cap. You push and turn. And all the lure locks are like that. Then we're going to pulse flush again. Push, relax. Push, relax. Push, relax. Push, relax. Push, relax. So you keep doing that. You pulse flush your line. That helps actually clean it extra well. And remember, if you pull blood back, or if you're at the hospital and you've gotten a blood draw, flush twice. Okay? Then you're going to do your heparin. If you guys use heparin, some protocols don't. But my infusion protocol is to flush with heparin after. So these syringes crack me up. They're so tiny and cute. But it's just my 3 cc's that I need. So I'm going to do the same way. Just do that and push. And then the other thing about clamps. Most Hickman lines, probably most lines, tell you where to clamp. I don't know if you could see it. There's this clamp here. That's not showing up at all. Barely. And there'll be like 2 arrows. This wears off after a while. I've had this line. How have I had this line now? A while. So, I mean, it'll eventually wear off. But you'll remember approximately where along your lumen you can clip. And what